I'm Roger DeRose. At Kessler Foundation, we're committed to changing the lives of people with disabilities through research and employment strategies. And that's why we're proud to support programming produced by the Caucus Educational Corporation and their partners in public television.
Meeting the needs of people with disabilities, next on Caucus, New Jersey.
Funding for this edition of Caucus, New Jersey has been provided by Kessler Foundation, changing the lives of people with disabilities. Suez, ready for the resource revolution. MD Advantage Insurance Company of New Jersey. Johnson & Johnson. The Mental Health Association in New Jersey. New Jersey Sharing Network, dedicated to saving lives through organ and tissue donation. And by Partners for Health Foundation, partnering to make our communities healthier, better places to live. Promotional support provided by Meadowlands Regional Chamber, building essential connections that drive business growth. And by NJ Biz, all business, all New Jersey.
Welcome to Caucus, New Jersey. I'm Steve Adubato. The question is, how can medical professionals better serve patients with different needs? Here in the studio to discuss this very important topic, we have Diana Stolfo, who is a self-advocate for people with different abilities. Cedar Wang, who has been with us before, is the Director of Simulation Education at Holy Name Medical Center. Rabbi Yisrael Rothwachs is the Dean of Snai Schools. And finally, Joanne Stolfo is a parent advocate for people with different abilities. I want to thank all of you for joining us. Now, Joanne, you and Diana are related?
Yes.
How so?
Diana's my daughter.
Yeah, Diana, I want to thank you for joining us. I want to thank all of you for being with us. Do me a favor, Cedar, you've been with us before,
Sure.
and you know, this whole question of serving the needs of patients with different abilities. Mm-hmm. Why is this such an important issue, and what does simulation education have to do with it?
Great question.
Loaded question, I know.
Yeah, loaded question. Well, we came to realize through our partnership with the Snai Schools that as a hospital, as an institution, we could do better with our sensitivity to people that have different needs. Many needs are not so apparent. If someone has an intellectual disability or a cognitive issue, the physicians and nurses interacting with them don't necessarily know. So we set out to determine how we could formulate a program that would help us to train our nurses, physicians, social workers, really any healthcare worker to be more sensitive to those kinds of particular needs that that population may have.
Is it different?
It is different. It is different. There are social needs. A patient may come into the doctor's office with someone. Now, it could be a parent. It could be, if they're in a group home, it could just be a caretaker that earns a minimum wage and works in the group home. Yet a physician or nurse may think that that person is involved in making medical decisions for that patient. And that's certainly not all the case. Right.
So
exactly.
It's so interesting. Diana, I'm sorry for interrupting.
That's fine.
I'll come back to you. I apologize. You told our producers, sometimes when you go in to see the doctor, a doctor is, you're right there as the patient, but the doctor starts talking to your mom.
Yes, because to me it feels like they're disrespectful to me because I'm the patient and they should speak to me directly, even though they speak to my mom, because they probably don't realize that I don't have a voice, but I do, that I can speak up for myself.
Cedar, as you hear that, how common?
That as we've interviewed, done different focus groups with other folks, we have found that that is often the case, and that's an issue. So we want to, through this training and through immersing physicians and nurses into these scenarios, we want to train them to be sensitive to that, to speak directly to a patient like Diana, and not necessarily to mom or whoever may be with her.
So when you're in that situation, and it's happening, and it's, by the way, it's happened over time.
Yes.
And you're how old right now?
I'm 34, will be 35 this year.
Okay. So it's happened over a period of time. How did you deal with it? How do you deal with it?
Well, of course, when I was bringing her to the pediatrician, it wasn't an issue. The pediatrician would need to speak to me. But as she got older, Diana's pediatrician was very respectful of her. And I learned through my work with SPAN of New Jersey to turn
What
my...
is that?
SPAN is a statewide parent advocacy network.
Okay.
And I worked there while Diana was in school to help other parents advocate for their children in school. And I learned to just shift my gaze to Diana. And once I would turn my gaze to her, the doctor had no, or healthcare professional had no choice but to look at her as well.
Wait a minute, hold on. You would literally look at your daughter
Yep.
and give the healthcare professional no choice but to engage Diana.
Right.
They had no choice. They had to talk to you.
Yes, because I'm the patient.
You made them talk to you. They had to talk to you.
Yes, they had to talk to me because the information is coming from me.
And see, and I'll come to you for a second, Rabbi. I'm just very engaged. I'm sorry. You have become an advocate, a supporter for others who are dealing with this issue. Why?
Why? Because in many dialects that people have, like with their disabilities, are different, that they have a hard time speaking for themselves, and that I became an advocate because I help myself, but I advocate for myself, my fault. But I also advocate for others. Say if someone can't speak for themselves, that I encourage them in a way so they could speak up for themselves too as well, with their experiences.
It's so important you're doing that. Rabbi,
Yes.
your organization, describe it.
Sinai Schools is a series of schools in northern New Jersey that serve kids with special needs, 1st through 12th grade, really till 21. Each one of our schools is housed in a regular yeshiva day school so that our students can be integrated within the community.
What are you hearing so far in this conversation?
Firstly, I'm so inspired. I only met Diana, a few minutes before the show, and she's so inspiring and so articulate. And she's lucky in that way because her mom could really look to her and say, it's all yours. You have a conversation with a doctor. But we know that there are many people out there who don't have those skills that Diana does and perhaps can advocate for themselves. And we want to put them in a position where the doctors are sensitive enough to make sure that they're giving them the care that they deserve, respectfully, and hopefully they're getting the actual medical care that they need.
The rabbi raises an interesting point. Because Diana is so strong and clearly says what she wants to say, how she wants to say it, and because I am a novice in this field and don't really know very much, one of my first instincts is to ask the question, so what about for someone with different needs who is not as articulate, who is not as charismatic and strong? What about for that patient and his or her family member? Cedar.
There's still an element of dignity that we want to be sure is preserved in that interaction. Even if there is a situation where the patient isn't able to advocate for themselves and there's a caregiver or guardian with them, there's still an element of respect and dignity and a certain level that they are able to understand and be involved in their care. And so that's what we want to promote, really full and as much independence as possible for the patient, and also sensitive to the caregiver, that it is an extra burden to make decisions for someone else when they're unable to. So it's that type of sensitivity that we want to explore further with our physicians and nurses through this program and really open the dialogue to what that looks like.
Speaking about opening the dialogue, when you speak to other parents, first of all, how do you interact with them and what does that conversation sound like?
When I speak to other parents, generally, my attitude is that you need to be assertive but not aggressive. That you need
Define the difference.
The difference, to me, assertive is stating your rights in a respectful way and knowing what your child's rights are, listening and respecting the other person. Aggressive is going in, yelling and screaming that you want something without treating the other person with the dignity they deserve.
I've been told that if you don't understand something that a doctor is saying or a nurse is saying, is it true that you will raise your hand?
No, but that's an advice. But I actually, with doctors and nurses, I just talk regularly, have a conversation with the doctor because they know me and that they respect me and they listen to me what I have to say.
But what happens if you don't understand what they're saying?
I tell them because sometimes I learn, because sometimes I process differently, but I do get to the point.
How much do you actually think about what other people think of you?
That think of me, that I'm a role model, that I help others to advocate for themselves, and that's why I'm a self-advocate. And for myself, because we're all in the same boat. We're all independent. It doesn't matter. It's not like selecting people in a way like selective, but I don't like that. It's about what we all can do in this world.
If someone else who has different needs and is having a hard time says to you, Diana, I can't do it. I can't do it. I can't talk to the doctor. What do you say to them?
I say, believe in yourself. You can do it. You can do anything you want if you can put your mind to it.
When did you know that she was like this? When did you know that she had this level of confidence and just believed what she just said?
May I add something?
Oh, sure. I'm not surprised.
I learned it from my parents. My parents are our biggest supporters, and my family to encourage me the best Diana I can be.
I'm going to go out of order. I usually wait to the end of this show, but I'm going to ask you now. I think a lot about leadership. And I write about it, and I teach, and so I ask people what it means to be a leader. You're a leader. What does it mean to you to be a leader?
It's like, let's say, leader of the pack is like a leader for everybody, so that everyone it's like a follower. And that someone and then a follower that they follow, not physically, but they follow me in a way that with healthcare experiences or other things that I help them to get resources. I get all this information that I share with others.
Is leadership helping people?
Yes, it does. But they can be a leader too.
You want to comment?
I think exactly what she said, that, you know...
now you're going to say what she said.
Exactly what she said. She is an inspiration and a motivator to people, and so that's what makes someone like Diana a leader.
Go ahead, Rabbi. Now, go ahead. I was reading Rabbi Kushner's book the other day, and I'm just thinking about her and trying to make sense of it. Make any sense to you?
Absolutely.
Go ahead.
You know, I was going to say what she said. That Diana may not even realize it, but just her inspiring. The definition of a leader is somebody who can inspire others to rise to the occasion and to do good and to grow and to impact others. And that's what Diana is doing.
Isn't it funny that sometimes great leaders are people who see things in other people that those same people don't see in themselves.
Right.
And that's who you appear to be. Mm-hmm. Someone who sees something in other people.
Yeah, no, we're very blessed. Diana's able to learn quickly,
Yeah.
and she watched me advocate. She watched.
What do you mean? She watched you advocate.
Well, when I worked for the statewide parent advocacy network,
Right.
SPAN, I helped with classes and workshops to train other parents to. SPAN is New Jersey's federally funded parent information center. Way back in the 80s, the federal government realized if children with special needs had rights in the educational system, but didn't know, if the parents didn't know
Sure.
they had those
So
rights.
where was she in all this? She was
A student,
watching it?
A student. Well, I also encouraged her when she wanted to run for, say, secretary of the student council. I said, well, maybe secretary is not the best place where you could use your talents. Why don't you become the representative of students with special needs? So, taking her back from the goal that may have been unattainable to a goal that was attainable and something that she would be good at was one way of encouraging her to go forward.
So, guiding, encouraging, but not controlling.
A fabulous school system. And
Yeah.
You can talk about
Yeah.
The education.
public
was-
speaking.
The public speaking class which I took, which I loved, that was helping me to become an advocate so that I could help other people with disabilities and everybody else to advocate for themselves too.
So you've taught, you've spoken before medical classes.
Medical students.
Medical students, I
Yes.
apologize. Thank you for
It's
correcting
okay.
me. What did you tell them?
Medical students, I told them about my medical experiences with my health care, how I maintain it myself because I don't have a guardian. I'm my own guardian, so I'll make my own health care in my own hands, and that if I need answers that I don't know, that I turn to my parents and I ask them for their advice.
Can I interrupt?
Can you interrupt? I don't know. Ask her.
Part of what I wanted to point out is that if everybody had the ability that Diana has, we wouldn't be sitting here.
Why do you say that?
Because she would go to the doctor, or everybody would have these abilities. They'd go to the doctor, and if they weren't being cared for properly, or if they didn't understand something, or if they felt like they weren't being given the dignity that they deserve, they'd be put in their place. I've never seen you in that situation, but I imagine that you would get what you wanted in a respectful way,
Right.
at the end. But there are so many people out there, and frankly, not just individuals with disabilities, but even their advocates, like you were pointing out before. Even their parents or guardians don't know how to advocate for them all the time, and so that there are many people out there who need medical care and who can't advocate in the same way. What Diana has done is inspiring, but I don't know that it's typical.
So I don't even know what is typical.
Right.
I know you're talented. I know you're inspiring. But the other part of this question, the other part of this conversation, Cedar, that I want you to comment on, is a larger societal question, and it has to do with the healthcare community, but there's something bigger here, and I'll get there, I promise. And it's this. It's the difficulty that many people have simply interacting with, engaging with people with a disability, a different need, or different needs, that they literally cannot convince themselves, they just won't. Am I making too much of that? And A, and B, has it changed dramatically in the last X number of years?
I don't think it's changed that dramatically, though. The healthcare environment has become more complex and more difficult to navigate, I think for all of us, but especially for those that have different abilities. So we want to take some of the burden. We heard a lot about advocacy and how important advocacy is, and surely that is, that's wonderful. It's not foolproof. And so we want to take some of the burden on ourselves as a medical center, as medical professionals, to be extra sensitive, to make it that much easier, and to safeguard for those people that are not able to advocate for themselves or who don't have competent advocates.
So hold on, stay on that. So I'm talking about the broader societal question. Do you think that medical professionals as a microcosm of society, need to work harder to be more empathetic, to understand, to have greater skills and ability to interact with people with different needs?
I think yes. I don't think that's a change. It's just something that we've come to realize, and now with this type of particular training, rather than a lecture or a presentation, we can engage them at a different level.
What does it look like, the simulation education? But make it clear to folks, because
Sure.
it's not, I haven't given you that chance, so go ahead.
Sure. So simulation training is really a hands-on, immersive experience. So we would not necessarily tell people what to do, but we would put a physician into a room with maybe 2 actors, maybe Diana and her mom, and have them carry out a conversation. We would videotape it, and then we would pick apart what did they do well, how could they improve, how could they make the whole experience that much better for everyone, including making sure that they ask the right questions, that they're sensitive to the needs, that they communicated slowly, clearly, assessed Diana's understanding. I'm just using you as an example because I think you'd be a great actor in our training. But so it's a real live experience that can't be learned in a book or a lecture, and that gives greater insight to our medical staff.
You know, the problem would be if you tried to get Diana to act, the problem would be she has acting experience.
That's right.
Because you
might not be able to afford her.
You're on 2 episodes. Is it not a fact that you were on 2 episodes of Law and Order?
Yes.
In 2010, were you on?
Yes.
So she has an agent. You'll have to go through the agent.
will have to.
No, she doesn't. Are you the agent?
No,
You're a
she doesn't
stage
have an
mom?
agent.
No, you are not a stage mom. We already established that.
I think the 3rd time she needs an agent.
Well said. Rabbi, is that a smart move?
Absolutely.
Financial literacy.
Well, I do have, with my speaking engagements, I do have transportation, and most of my transportation is either my dad and also my mom as well. And I also have a self-hire that also could drive me as well to some of my speaking engagements and anywhere specifically. And to go back to the comment you mentioned about doctors and healthcare physicians, professionals, about with people with different disabilities and how they communicate and their disabilities are differently, that I do know for a fact that with my roommate, she doesn't really talk that well. She doesn't talk at all, and I could tell that people actually can communicate verbally, but also through pictures and also plastic models, which helped me. And one of my experiences I had as a doctor is that I was asking questions, and I saw this plastic model, which helped me to ask what the appointment is going to be about. That they can communicate through pictures and through models. That also audio too sometimes as well.
That's a great point.
Yeah.
Great point.
Yeah.
Rabbi, let me ask you this. How much have you learned, and how better are you doing what you do because of the interaction you've had with people who happen to have different needs?
Well, with Diana sitting by my side,
It's a loaded question.
It's a great example.
Yeah, right.
It's a great example. I think, to answer that question, to go back to something you said before about where are we as a
Society,
culture and
yeah.
society, I think that we are certainly, the buzzword around is inclusion, not just inclusion of people with disabilities,
Sure.
inclusion of people who are on the sides of culture in all different ways, whether it's with religion, whether it's with whatever
Yes.
it is. And I think that our ability to be more inclusive and to bring people into the fold, whether that's in schools, whether that's in work, whether that's in our churches and synagogues, we are miles ahead of where we were 20 years ago, 10 years ago, maybe even more than we were 5 years ago. And part of the reason why we're able to do the work that we're doing now with Holy Name is that our culture and society is at a point where they're ready to hear that. So while Cedar said before, there hasn't been that much change, but there's been change in terms of, I think, the readiness. And people,
We're ready.
What was that?
We're ready.
I think we're ready. I think people are able to, even though they may not have the skills, if we're talking about physicians right today, the physicians may not have the skills to be able yet to interact in the way that gives dignity and proper medical care to people with disabilities. There's a will to have that conversation and to be better at it.
Well, I want to thank all of you for joining us and having this timely and important conversation. And while I very much appreciate the three of you being here, I just want to give a special thank you to you, Diana, for being with us. You've added so much to the public television conversation, and you've taught many of us a great deal. Thank you.
Thank you.
The preceding program has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence, and 13 for WNET, NJTV, and WHYY. Funding for this edition of Caucus New Jersey has been provided by Kessler Foundation, Suez, MD Advantage, Johnson & Johnson, the Mental Health Association in New Jersey, New Jersey Sharing Network, and by Partners for Health Foundation. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. Caucus New Jersey has been produced in partnership with TriStar Studios.